gonna tell me when she's ready.
I'm ready.
You're ready? Okay. Well, first of all, welcome everybody. It's nice to see a lot of familiar faces and also some new ones. So if you see somebody next to you you haven't met, make sure you introduce yourself when there's a pause. I'm Stacy Albanesius. For those of you that don't know me, I'm the secretary of the Williamson County League of Women Voters. And I want to thank you all for coming. And I don't think anybody from the library is in here, but just thank the library for hosting this meeting for us for the first time. Before we get started, I just want to give you some updates on some dates and some important information, and then I'll turn it over to Nancy. So after the success of our first evening mixer about a month ago or so, we decided we wanted to have another one. So mark your calendars for Tuesday, October 28th from 5 to 7. It's at Fozzie's Bar and Grill, which is new in Franklin. So excited to try that out. I've heard wonderful things about it. If you can let Cynthia know about it, Cynthia's man in the camera over there, that would be great. The next thing is that it's a busy election season, as you probably all can see by all of the commercials and all of the signs everywhere. And so one of the services we provide for anyone who's new to the local election board is through poll observations. And so wanted to let you all know that on the Tennessee's 7th Congressional District Special Election Primary, I know it's a lot of words, we had 9 volunteers who devoted a total of 21 hours as poll observers. And if anyone's interested in participating in that, there's a lot more elections coming up. So just let one of us know. And then speaking of upcoming elections, the City of Franklin municipal election, early voting is happening right now. I think Colleen over there has my daughter's sticker that got selected for voting on. Election day is actually October 28th, but you can early vote through October 23rd. So make sure you're aware of that. And if you need additional information on any of the candidates, we co-sponsored a forum with Williamson Inc. And a few other organizations. And so there's a video out there of that forum on Williamson Inc. And I think Peg sent out in the email a link to that as well. So that might be a good resource for you. Lastly, just put in a plug for the local league, as we have an anonymous donor who is donating $50 for every new member we get through the calendar year. So if you haven't already joined this amazing group of women, and a few good men, now is the time to do so. And if you want to grab a business card on your way out, there's information about voting on there if you'd like that. So thanks again for coming, and now I'm going to turn it over to Nancy Garrett, who is our Vice President of the League, and she's going to introduce our speaker.
Thank you, Stacy. For those of you who may not know what Stacy was talking about the sticker, you know, there's a contest every year for students in the local schools to do a sticker to promote voting, and Stacy's daughter won. And so really cool. It's great to see everybody on this beautiful fall day. And I'm really honored to be able to introduce Emily Jenkins to you all. Emily is a Franklin resident. She works as an attorney with the Tennessee Justice Center. And what is the Tennessee Justice Center? Well, the Justice Center advocates for Tennesseans facing issues of hunger, health, independence, and legal issues. And TJC also works with individuals, but the organization looks and says, is this something that's going to impact lots of people? And if so, they'll create kind of a large-scale change or challenge for other people facing that issue. Emily is a Nashville native and is a proud graduate of McGavock High School. Were you in the band?
Oh, no.
Okay. McGavock High School. McGavock High School band was very famous during that time, as was the theater department. She obtained her JD from the College of William and Mary and her BA from Rhodes College. Previously, Emily is a mom of 5. And she was a community volunteer for a long time. She focused her work on child welfare advocacy and pro bono matters as a solo practitioner as well. And as I told you at TJC, she serves as a staff attorney and is the director of the Healthcare Justice Clinic, which is a partnership with the Belmont University School of Law. In addition to her work for TJC, Emily was and is an active volunteer with Tennessee CASA, with Williamson County CASA, with Legal Aid, Hard Bargain, and the Franklin Justice and Equity Coalition. And as I said, Emily's a mother of 5, lives in Franklin with her husband, Chris. So we're going to hear from Emily now. And Emily, we would ask that you go to about 45 minutes, and then we'll open the floor for questions. So everybody, ladies and gentlemen, Emily Jenkins.
Thank you, Nancy. I'm going to turn on my clock so that I keep mindful of my time. So as Nancy mentioned, my name is Emily Jenkins. I've been staff attorney at TJC for the last 2 years. I've been running the Healthcare Justice Clinic for the last year, which, as she said, is a partnership with Belmont Law. It allows me to teach a healthcare law class at Belmont and to train young lawyers in the joys of pro bono work. So I wanted to share with you a little bit. I'm going to start with a little bit about the history of TJC and just the overall picture of what we do. And then I wanted to focus on some of the really timely issues we're facing right now with the passage of the OBBA and what that's going to mean to public benefits in Tennessee. So our tagline at TJC, as you'll see, is with liberty and justice for y'all. Our disclaimer, I believe, matches League Women Voters, which is that we are a nonprofit tax-exempt organization and we are nonpartisan and non-political. This quote, I think, really sums up the work of TJC and how important it is in our state. Poor, disabled, and otherwise disadvantaged Tennesseans should not require luck, perseverance, and zealous lawyering to receive health care benefits they're entitled to under the law. This quote comes from a recent decision from last fall in one of our class actions that focused on the hundreds of thousands of Tennesseans who lost insurance coverage post-pandemic when the state started going through renewals and basically screwed up every possible way they could. So we had a class action lawsuit. I'll talk about that again in a moment. But with the court recognized that when the state fails systemically like this, the incredible impact it has on people in poverty who really require these benefits to survive. TJC was born in battle. So if you were politically active in the 90s, you may remember Newt Gingrich was on the scene. And one of the things that he really championed was a change to the structure of the federal legal aid program. And that change said that legal aid organizations that receive federal funds cannot do systemic class actions. That was a huge problem for legal aid. At the time, TJC's founder, Gordon Bonnyman, and co-founder, Michelle Johnson, were both attorneys with Tennessee Legal Aid, and they were working on multiple systemic class actions to address really overwhelming issues of need in Tennessee. When the change happened to the funding structure, Gordon said, if legal aid can't do the work, then I'm going to just figure out how to eat, and I'm going to go do it myself. So there was a group of lawyers who got together across the state, from the state bar, who said, we recognize the importance of systemic action to really get the kind of relief that makes real change. And that was what began the funding model for Tennessee Justice Center. We've been open for this, we're going into our 30th year. Our team now, we have a little over 30, it fluctuates, and that's comprised of our client advocates, our attorneys, there's 6 of us now that are practicing attorneys, and then our advocacy team with a staff of a little over 30 and 11,000 volunteers last year. We're very, very blessed to have a very active internship program that runs throughout the school year and a law clerk program. With those volunteer hours, our tiny team was able to do almost 3,000 cases. We secured $11.7 million in benefits across 94 counties in Tennessee. So we do operate statewide. It irks me that we missed just barely getting every county, but we're gonna get it next year. If you know somebody in Dyer or Lake County who needs help with Medicaid, let me know. Our team's divided into 3 groups. We have our casework team, which, like I said, is our client advocates. Those do the individual cases for the Medicaid, SNAP, and WIC programs. We have our litigation team, which is informed by that casework team. So when we've had 7 cases of people who were terminated without notice this month. We say, well, okay, wait a minute, there's something happening here that needs to be addressed in a larger way. So our client advocates and our casework team informs the litigation team where we need to take those larger actions. In the last 2 years, our largest actions have been the case I mentioned earlier, AMC versus Smith, which focused on the wrongful terminations of people from Medicaid. We're currently in the resolution phase of that. The judge keeps sending us to mediate with the state as to what the remedy is going to be for them violating people's rights. Unsurprisingly, the state's response is, who needs a remedy? So after, I think we're at 4 mediations now, I think the judge is actually finally going to make a decision on it, and we'll have a good result. We also have another class action we filed in January, Bull versus Carter. That class action is focused on the SNAP program. The SNAP program, in the last year, we were noticing an uptick in people who were waiting months for a decision. You're supposed to apply and have benefits within 30 days. I should back up just to clarify terms. SNAP is EBT is food stamps. Those terms all mean the same things. The SNAP case has been certified as class action, and we're currently advocating for changes to that system to make sure that people who are qualified for benefits are receiving those benefits and are receiving them in a timely manner. We also have an advocacy team. The advocacy team goes across both the nutrition and health programs. What we're advocating for changes throughout time. We've had a pretty strong WIC advocacy program for the last couple of years because the Women, Infants, and Children's program offers really, really critical benefits to young mothers and their babies. It offers them the formula and additional food support they need. It is sorely underutilized. People don't understand they're eligible for it, they don't understand how it works, they don't apply. So our WIC advocacy has largely been around just making people aware that it's out there and how they can connect to the program. We've been advocating for improvements to the SNAP program, both through the individual casework and the systemic class actions. And then school and summer meals access. If you think about school meals, one of the things that Tennessee does that is frustrating to those of us who really advocate for anti-hunger work is we spend a lot of money splitting hairs. So for people who qualify for free lunch versus reduced lunch, it's a huge administrative burden to try and screen the difference between yours is free and yours is reduced. If they just made it free lunch for people who qualify, the administrative burden would offset the additional cost of benefits. The state won't do it. There's also summer EBT, which is a program that provides an additional $120 per child at the beginning of summer so that families who receive SNAP benefits have some extra money to offset the fact the kids aren't going to school. You know, there's a lot more, if you, like me with my 5 children, try to feed kids in the summer, it's amazing how exponentially your food budget goes up when the kids are home all day. We did participate as a state in summer EBT 2 years ago. It was amazing. It helped a lot of families. Last year, the governor declined to participate. He rejected the federal funds, and instead of spending $3 million for the state portion of that program, he did an alternate program that only served a fraction of children in 10 counties, leaving most of the state out. And even in the 10 counties that were allowed to participate, because the program was so small and so poorly advertised, very few people participated. So we spent hundreds of dollars more per child to serve less kids when the state could have adopted the program. That's one thing that we're really advocating for now. The governor's got the option to make that decision again for next year. And so we really want to get people out there talking about how important it is to make sure that kids are healthy and fed. This is our welcome home. So TJC in our 30 years of living has been many places. When it was initially established with the shoestring budget, it was an attorney downtown Nashville let Gordon and Michelle operate out of the attic of his house. It has been in a church basement. It has been been in the basement of a parking garage. It has been on a basketball court. It's been many places. But 2 years ago, we were fortunate to be able to move to our permanent home, which is on 155 Lafayette Street. We're just down between Cameron Middle School and Tribeca Nazarene. If you know that area, it's in the middle of the Napier-Sudicum projects. It is an area of extreme concentrated poverty. What that's meant for us is that we had to change our model a little bit, because when we were the nomads around the downtown Nashville office buildings, no one came to see us. We didn't have such a thing as a walk-in. In our new home, we do. We have a fairly large unhoused population that's nearby, and then the people who live in the Napier homes. So we're doing a lot more in-person work with our walk-in clients. One thing I'll put out there is, if you ever want to come see us, please contact me. We love to give tours. And one of the reasons we love to give tours is because our building is amazing. And part of what makes it amazing, you can sort of see in the left picture, that's Chadwick Boseman. That's a picture of Black Panther on the left. Before we moved into the building, during COVID, there's a man named Charles Key that's done a lot of really, really moving street art graffiti murals throughout Napier-Sudicum. He painted that to encourage people to get colon cancer screenings in honor of Chadwick Boseman and in honor of his own father, who passed of colon cancer. When we were trying to figure out how to fund this building, this very much felt like a sign that this was where we were supposed to be. But going around the rest of the building, if you see on the right, the large mural there, that also was done by Charles Key, but it tells the story of the integration of Metro Nashville Public Schools. It's a mural done of a photo that was taken the day that the first children went and integrated the Nashville schools. Throughout the rest of the outside of the building, we have murals and artwork dedicated to other Black heroes of the area, so we love to have people come. Even if we're not there, there are QR codes all around the outside of the building where you can self-tour. We also have a community space that we rent out, so if you ever need space in Nashville, we need money, so please rent our space. Nancy knows I'm shameless, so I'll be So that brings us to where we are today. We continue to do the work we've always done around eligibility for Medicaid and SNAP, your enrollments, your renewals, services for people with disabilities. That's still the core of our work. But right now, we're also having to respond to some rapidly changing conditions around who's eligible, what the processes are going to be, and how to navigate those systems with no one understanding, including the agencies, how they're supposed to implement some of these changes. So the big challenge right now is OBBBA. You may know it as the One Big Beautiful Bill Act. The main changes you're probably familiar with. It made the Trump tax cuts permanent, increased spending for military and immigration enforcement, and those increases in spending and tax cuts are partially offset by cuts to Medicaid, CHIP, which is the program for children's health insurance, SNAP, and child nutrition programs, including WIC. It implements a broader agenda by repealing environmental regulations, climate initiatives, and social spending for educational loans as well. Just a primer, I know before 2 years ago when I started work at TJC, I honestly didn't know the difference between Medicaid and Medicare. It took me a little bit. So if you think about it, Medicare is your coverage for the elderly. Medicaid covers 71 million people. It originally started out as a welfare program, and it's largely become the backstop for affordable care for all kinds of people in need. In Tennessee, our Medicaid program is TennCare. That is another thing we would love for everyone to, if you leave with nothing else today, please understand when people say TennCare, that's Medicaid. So many people don't even know that they're on Medicaid because the name confuses them. Our program covers 1.4 million Tennesseans. Half of those are children, including medically fragile children. It also covers 60% of nursing home residents. If you've ever had a loved one in a nursing home and dealt with those costs, you you know, it's really difficult to outwork the cost of nursing home care. You're talking $10,000 and up per month. It's also the principal coverage for people with disabilities. So there are a lot of services that you can get through Medicaid that it does not matter how good your insurance is, you will not get it through private insurance. It's incredibly important, like for our medically fragile children who need home health nursing, because most private insurance does not cover home health nursing or covers it with a very limited benefit. You think about services for kids with disabilities, things like speech, OT, PT. Most private insurance plans will cap you out at maybe 20 visits a year. Medicaid is far more generous. So as coverage for kids with disabilities in particular, it provides a service model that you can't buy with all the money in the world. It also covers prenatal and postpartum care for half of all pregnant women and births. Even, again, people who have private insurance often find that they may have a $5,000 deductible they haven't met for the year. And so their prenatal coverage, sure, you have prenatal coverage once you pay $5,000, which most of our families who qualify for Medicaid would not have. Tennessee has the highest maternal death rate in the United States. So that coverage for prenatal care and pregnancy is even more important in Tennessee than in a lot of other states. It's also the largest funder of treatment for drug treatment and mental health care. So this is one of the things that we want people to understand, like when we say this is not political, and we talk about the importance of understanding what the challenges are with Medicaid funding, it's knowing, if you think about the Jillian's Law, you all are familiar, the young lady from Belmont that was unfortunately brutally murdered by someone with mental illness. The goal of Jillian's Law is to make sure that people who need critical mental health services aren't just out on the street committing crime. Medicaid covers the services these people need. So even if you're someone who does not feel like healthcare is a human right, even if you don't think that people in poverty should have access, people need to be aware that when people who have mental illness don't get the care they need, it does not just impact them, it puts us all at risk. It's also a major source of funding for school health and school mental health. So a lot of your counseling services that occur during school hours are funded with Medicaid dollars. For children who may need a one-on-one aide that has to provide medical services during the day, that's typically paid for with Medicaid funding. It is the primary source of coverage for rural Tennesseans and critical to funding of the rural healthcare infrastructure. When you look at the list of hospitals at risk of closure in Tennessee, it's pretty long. Because if you have a rural area where you have a high concentration of poverty and those people only have health coverage through Medicaid, when they lose their coverage, they don't stop getting sick. They go to the hospital for uncompensated care. The hospitals simply cannot absorb that many uninsured patients. So again, when we talk about the importance of Medicaid, it's not just for the enrollees. If you've got private insurance and you live in an underserved rural area, your private insurance does you no good when there's no hospital to take it to. It provides coverage for 24% of small business owners. So when you think about the importance of Medicaid for our overall state budget, we want people working and healthy. That's really hard to do when you don't have health care. And so Medicaid also helps to lift up people in poverty by allowing them to have the health care they need to stay healthy and work. It covers 36,000 Tennessee military veterans. So not every military veteran is entitled to keep military health care. And these people who have served often really rely on the services that they can obtain through Medicaid. Federal Medicaid funds are $9.5 billion, or 18 cents of every dollar in Tennessee's budget. I mean, healthcare is a huge part of the state budget. In addition to TennCare, the federal Medicaid dollars are also used for multiple other agencies that you may not think of as being healthcare related. Children's services. Medicaid dollars help fund when you have a child in DCS custody who may need residential services because of the abuse, the neglect they've suffered. Those placements are funded with Medicaid. So are the in-home counseling services that help them to stabilize in a foster placement or through reunification. It helps fund the services that the Department of Disability and Aging provides, not just to Medicaid eligible people, but to anyone with disabilities in Tennessee. I mentioned before, it helps provide education, it helps fund the county health departments and the services that they provide. Mental health and substance abuse services, you may have heard of that as the behavioral health safety net. The behavioral health safety net is what helps provide the critical care for people who need substance abuse services, but they don't qualify for Medicaid. And I probably should mention, when I talk about people who don't qualify for Medicaid, Tennessee is one of the states that has chosen not to expand Medicaid. And it's important to understand what that means to our state and how that has impacted us. Our state caps the coverage for caretaker relatives at 100% of poverty. So if you are a mother who has 3 children in your household, if your income goes over 100% of poverty, you lose your health care. In states that expanded Medicaid, it goes up to 137% of poverty, which is significant. Also, we have very, very limited coverage groups in Tennessee. So our coverage is limited to caretaker relatives. You have a child under 18 in the home. It can be your own child, grandchild, niece, nephew, stepchild. You're a child under 18. You're pregnant or you're disabled. Or you have breast or cervical cancer. I don't have an answer for why only breast and cervical cancer. That's one of my least favorite discussions to have with somebody who comes to us and says, I have stage 4 brain cancer, and I have to tell them, you have the wrong kind of cancer in Tennessee. You don't qualify for Medicaid. Now, the Affordable Care Act is not Medicaid, but it's related. So you will hear it as Marketplace, you'll hear it as ACA, you'll hear it as Obamacare, you'll hear it as healthcare.gov. The ACA Marketplace provides coverage to people who are over 100% of poverty, and it does so by using premium tax credits to make that coverage more affordable. The premium tax credits process is confusing, but essentially you're getting an advanced rebate on your taxes that helps you pay your cost of your premiums every month. One thing that is causing the government shutdown right now is the fight over the termination of the expanded premium tax credits. The ACA covers 628,000 Tennesseans through the health insurance marketplace. And of those Tennesseans who enrolled in a marketplace plan, 96% of them rely on premium tax credits to make the coverage more affordable. So you can buy an ACA plan if you're over the income limits. You're just not getting those premium tax credits. But for some people who don't have access to employer-provided insurance, that is really the only available product. But the enhanced premium tax credits are what brings the cost down to truly affordable rates for most people who are in that very low poverty level, that 100 to 150% of poverty. The enhanced premium tax credit legislation expires December 31st. And so that's one of the things that I think advocates get frustrated about when people are talking about the government shutdown, is people don't understand when the conversation is, we'll just reopen and then we'll get an agreement. Don't hold it hostage for that agreement. Open enrollment for ACA plans is from November to January. If people don't enroll by January, you cannot enroll until next November. It used to be if you were below 150% of poverty, that was considered a special enrollment period. You could enroll year round. That has also ended. So you think about, young working adult man, 30 years old, gets diagnosed with brain cancer in February. He can't get a health insurance plan until the next November on the ACA. But if the enhanced premium tax credits are allowed to expire, people will have to make a decision whether or not to sign up for an ACA plan, not having those tax credits, which for a lot of people is gonna make it largely unaffordable. One other thing we're trying to put on the radar when we're doing public speaking about this issue is if you are on an ACA plan, you need to be aware that you're gonna get a notice that says what your premiums are going to be this year. It's going to be a lot more. And if you don't opt out, you will be auto-renewed at the higher premium rate, which you may not be able to afford. The Congressional Budget Office estimates, which is a nonpartisan group, estimates the cut is nearly $1 trillion in federal Medicaid funding over the next 10 years. It will drive another $300 billion in state matching fund reductions, resulting in $1.3 trillion in cuts. The expectation is that over 17 million people are going to lose coverage. 13.8 million of those will be Medicaid. 3.2 million will become uninsured as a result of the refusal to extend the ACA's enhanced premium tax credits. What we've described this is the death by 1,000 cuts. By making the premiums unaffordable, by limiting the time of year you can enroll in an ACA plan, by changing who's eligible to enroll for an ACA plan. It used to be that citizens or non-citizens with legal status, so people who are here as an asylee, a refugee, they're here on a humanitarian status, could purchase an ACA plan. They're no longer eligible to purchase those plans. And the expectation in Tennessee is that premiums are going to more than double, which when you think about the average household income and all of the other stresses we have on budgets right now, it's not affordable. So we're expecting almost 200,000 Tennesseans to lose coverage because they can't afford the new higher premiums. Another 46,000 will stay in, but if you know anything about insurance and how they come up with premiums, it's a risk analysis. So if you take the people who can take the risk and cancel their coverage and just say, I'm gonna go uncovered, I'm just gonna take the risk. If they leave the marketplace, then who's left? It's the sickest, the most reliant on services. And so even the premium increase we're seeing this year with the expansion or the end of premium tax credits, we're expecting an even further increase in premiums as the population that they're serving on the ACA marketplace is changing. The Medicaid cuts that you're hearing about on the news, one thing I will say, Tennessee didn't have far to fall. Because we're not an expansion state, the new work requirements do not apply in Tennessee. So that is one silver lining, if you will, is that those people already didn't have coverage in Tennessee, so that's not a new cut. I do think that's important to understand when talking about Medicaid in Tennessee, is that you'll hear a lot of sound bites about, well, it's cutting fraud, waste, and abuse, it's people who should be working. Those people aren't eligible in Tennessee. They were never on in the first place. Undocumented citizens were never on Medicaid. The working poor who don't have young children were never on Medicaid. Mentioned the tax cuts. The other issue is increased churn. So as people are having to go through renewals more often, you're gonna see people getting terminated because of procedural reasons. A lot of the improvements that were passed during the Biden era around how people apply and streamlined eligibility have been repealed. So there's more barriers to getting enrolled in Medicaid and Medicare savings plans. That's going to be causing a lot of terminations. Red tape's very effective. We talk about who it's going to impact. Hospital services, hospital closures, the ability to recruit and retain physicians, emergency services. Businesses are not going to be willing to relocate to areas that don't have access to health care for their employees. The other big thing to be aware of is the change to the nursing home staffing standards. There was a change that was going to increase the requirements for quality staffing at our nursing homes, including making sure they had a licensed physician on staff. That was rolled back, and the poison pill they added in, it was rolled back with a rule that no new nursing home staffing standards can be enacted for the next 5 years. So again, that's not just Medicaid enrollees. Every nursing home resident is affected by this rollback in a really important protection of making sure that staffing standards are keeping the vulnerable who are in these facilities safe. Quickly, I'll cover nutrition assistance. So the SNAP program, that one is going to be a huge cut in Tennessee. The implementation of the changes in the work requirements, they have lowered the age of people who have to continue working. They have ended the work exemption for former foster youth, kids who are coming out of terrible situations and really just need any help they can get. They've raised the age for the exemption for parents. It used to be if you had a child under 8 in the home, you were exempt from work requirements. Now it's a child under 13. Women, infants, and children is losing funding. School meals is losing funding. The $186 billion cut from SNAP is very concerning to us. As I mentioned before, the governor wouldn't fund summer EBT at $3 million. We're asking the state to absorb hundreds of millions of dollars in costs, $321 million in administrative costs that are going to be shifted to the state for the SNAP program. We don't know what the legislature will do. That's definitely one to have on your radar for the next legislative session is, do they find a way to cut other programs, or do they just say Tennessee's just not going to have food stamps available for the hungry? Because they can't, unlike Medicaid, they can't exempt certain people. They can't say we're only going to cover these people in Tennessee. It's federal rules say who has to be covered and what the benefit amount is. What's shifting to Tennessee is more of the cost of running the program. So, what can you do? I always love an action item. Just understanding the issue. So whether you land on the side of yes, people should have these benefits, or no, I'm good, fine. Just be educated so that you're aware of the actual tangible differences and not just listening to news stories that so often get it wrong on both sides. For TJC, I would say follow us on our socials. We have Instagram, Facebook, Twitter, TikTok. Our TikTok is run by a very fun young lady, so if you're on TikTok, watch our videos. Like and share our information. We do have newsletters you can sign up for that will give you updates to changes in the law and opportunities for trainings. We do a lot of free trainings in the community, so if you work at an organization that serves the elderly or the disabled and you would like to have a presentation, feel free to contact me. We're always available for that. And then League of Women Voters, of course, make your voice heard at the ballot. So if these are changes that you do not support, or if they're changes that you do, let your legislature know where you stand. Some of this is state decisions, like the decision not to expand Medicaid. Some of it is federal decisions. There will be upcoming state decisions for how we handle the federal decisions. So be active, understand where the candidates fall on this. And that's my email address. Feel free to reach out to me. The other thing I'll say is if you know someone who says to you, I lost my tank here and I don't know why, that's what we do. And that's what we do, always pro bono. We never charge a client for our services. So if you know someone who's having difficulty enrolling in or accessing benefits, TennCare or SNAP, contact us. We're happy to help. So I made it on the time. So now I'll take some questions.
That was impressive, because that was a lot of information.
So I have a question. When you said the nursing home coverage is being affected, is that skilled nursing facilities only?
It's the rule that would have changed the staffing ratio that nursing facilities had had. Yes, so not assisted livings,
Okay.
but it would have affected all residential nursing homes and staffing standards they had to adhere to.
Okay.
universal, and the only thing I could think of was dishonorable discharge, but it sounds like probably not, and I don't even know if that's the case.
Right.
But if you could share what leads into that.
It's the years of service and the type of discharge. I only know when they get to me and say, I don't qualify for my VA benefits anymore, I need Medicaid. So we don't really deal with as much of that. And we do deal with it some on dependents, because dependents who don't get certified as disabled before they turn 21, if they do, they can often stay on the veteran parents benefits, but it's not all of them.
I wanted to ask, I recently read a story when you talked about mental health care for individuals that are suffering mental health, that oftentimes they don't get any care until a horrific crime that they committed. So can you speak to that?
Yeah, I mean, it's a big problem because in Tennessee we have what are called waiver programs that cover special populations. The two primary ones are the Choices program, which is what covers the elderly to get in-home services and nursing home care, and ECF Choices. Why they named them so similarly, I don't know. It's like naming TennCare for Medicaid, I don't know. But ECF Choices covers people with intellectual and developmental disabilities before the age of 21. Both of those get you full Medicaid coverage and in-home services. Mental health is not a qualifying condition for either one. For the Choices program, you would have to have such a significant mental health issue that you need assistance with the activities of daily living. So you would have to be schizophrenic, bipolar to the point you can't eat, feed, bathe, and dress yourself. Otherwise, just having a crippling mental health condition is not enough to qualify you for Medicaid. It is one area, I will say, I do like to give the few bright spots. One thing we've been advocating, particularly for children who are entering DCS custody because of lack of mental health services, they are expanding some in-home services that are available to them that I think is probably going to make a difference, because a lot of these kids who may face going into residential care or may be in residential care and are ready to step down, the biggest barrier is parents don't feel safe with them back in the home without some supports. So the new program expansion will provide some overnight monitoring and in-home attendant care, at least for a little bridge period when these kids are leaving residential mental health. So that is a bright spot on the mental health piece.
So, everything seems so overwhelming. So I guess my question is, what keeps you up at night, and how do you deal with that? How does the staff deal with that? Because you're dealing with such hard things.
Yeah, it's a lot. We are very mindful of self-care. So we do a lot of trainings on self-care and secondary trauma. That's one of the things I teach my law students, is understanding you can't do this work and hear these stories and not leave affected by it. I happen to be fortunate that my default setting is fueled by rage. So for me, it works for me. Some people that doesn't. But we also do have really good stories. If you happen to go on our website, there's a video there you can watch of a young man named Connor Murphy that I had an opportunity to help this spring. And Connor has a progressive neuromuscular disease. He was not expected to live past age 2, but he has gotten an undergraduate degree, just finished up his master's, and has been accepted into a really prestigious PhD fellowship.
Wow.
In spite of being wheelchair bound, nonverbal, well, limited verbal. He's difficult to understand because of neuromuscular progression. But the case I got to help him on was there's a newly developed robot arm that made him, restored some of his independence, allowed him to open a door for himself, get a drink for himself, and TennCare said no. So TennCare said, that's just a convenience, sort of like a garter belt was actually the words they used in denying it to him. We fought that, we got it to an appeal, and we won. So those stories really do. It's those cases. Friday, I had a call from a young woman whose husband was in the hospital. He's almost 30 years old and has 2 children and has aggressive brain cancer. He needed a bone marrow transplant, and when they went to run his insurance, found that he'd been terminated from TennCare. I was able to do emergency outreach on Friday, which was followed up on Monday with TennCare General Counsel to find that that was a worker error. That they had terminated his coverage just by somebody clicking the wrong button in an eligibility system. So those cases, I mean, to say it's fun sounds perverse, but like those emergency cases, you know, it does. It's exciting to do because you really are seeing tangible, immediate results for somebody that's really in need.
You know, too, Emily, thank you for what you do. What comes to mind, because I've been around and been in situations with homeless people especially, when you treat them just basically with respect and care, even if you can't do anything necessarily for them, just the fact that you're sitting there talking with them and you care really makes, I think, a difference, a little bit of a difference in their life.
Yeah, I mean, we're super fortunate, particularly with the unhoused population that comes in for SNAP benefits, that you all being from Williamson County are probably familiar with One Gen Away, one of my favorite organizations. The Whitneys are some of my favorite people. But they have given us emergency food supply boxes, and the difference it makes to be able to help someone not only do the SNAP application to get those services, but to be able to hand them a box of food the day they come into the office, that's a good feeling. Yeah.
Any other questions? You mentioned Dyer County. What do you need in Dyer County?
A client.
A client.
Yes.
Okay.
Well, it's funny because, you know, our cases come from all different places. We get people who are referred to us by other people who have used our services, from disability groups, from school counselors, from sometimes TennCare, which is wild when that happens. But somehow Dyer County, the word has not gotten out, and it's not because there's no need in Dyer County.
I have a cousin who is a special ed teacher in one of the schools there, so.
Yeah, it's a lot. Curious, just for a quiz, can anybody guess what the county is that has the highest health equity scores in Tennessee?
Highest what?
Health equity scores.
Please.
Yeah, why do you think Williamson?
Well, access to health care, access to insurance, employer-paid insurance.
Yep, and race. There's a strong correlation between health equity and race. Race. Yeah, so the outcomes of similarly situated people, the care they're offered, varies wildly based on race. Some of it's cultural competency of the physicians, some of it's access, some of it's genetics, but there's a big swing. What do you think is the county with the biggest barriers to health equity?
Perry.
I'll give you a hint. You could go there for an auction.
Grundy.
Yes, Grundy. Yeah, Grundy because it's rural, high areas of concentrated poverty, low access to health care. That's the county that has the lowest scores on health equity in the state. And I mean, the swing between the two is wild. I mean, even looking at the neighborhood where TJC is located, because it is high concentrated poverty, the average lifespan of residents in the Napier-Suticum projects is 65. So, I mean, you look at what concentrated poverty and lack of access to services means. It's a food swamp, we call it, which is when you refer to an area. It's not a food desert because there is food, but it's gas station food. So those food swamps really impact people's ability to live healthy lives too.
I've heard it's either Tennessee or Williamson County that 92% of the people have health insurance, and I just found that really hard to believe. So can you give me some real data on that?
Looking at Williamson County specifically, I'll tell you where you can get that data point is we were also very blessed in the last 2 years to have an Equal Justice Works Fellow, which is a funded position. She's a brilliant young attorney from Vanderbilt. And she created a data dashboard that you can see linked on her website, and it has layers by county of all kinds of social determinants of health and access issues. So that would tell you, it's the data dashboard. So if you go to tnjustice.org and you click on resources, you can see the data dashboard, and it's interactive, it's super easy to use, and it was just updated. She rolled out the update last month, so that has all kinds of information. You just kind of want to see, you know, if you have a loved one in another county and you want to see what's up where they live, you can get a lot of information about access to services.
Anything else?
Yep.
I have a quick question, something that stood out to me most from your slide. Can you give us some insight into why Tennessee has the highest maternal death rate in the nation?
Yeah, so a lot of it is lack of access to healthcare. So because we're a non-expansion state, we have some of the highest rates of uninsured people in the country. It's the poor rural health network that's getting worse. So there are a lot of counties, again, if you look at our data dashboard, you can see there are multiple counties where there is no OB in the county. There are multiple counties where there is no pediatrician in the county. So when you go to give birth and you have to drive an hour and a half to get to the hospital, you think about all the things that can go wrong in that time, it's a lot. We also don't have as much access to things like doula services and postnatal care that a lot of other states have added to their Medicaid programs that do make a difference in health outcomes.
We have time for one more question. Anybody has one?
Well, thank you for having me.
You're so welcome. If you do have questions, Emily is very responsive, and I will say that I've called the TJC before to inquire about something for a relative, and they are so good at following up. You know, I think that is really something that's so impressive about the organization, is that they really follow up and try to understand where things are. People don't just get dropped, so.
Yeah, we were very lucky. If you have any interest, there's a group called Impact 100 Nashville. It's a women's giving circle. I'm a member. And the women who are members of it give $1,000, and then every year they give out grants to nonprofits. So if you're just interested in supporting nonprofits, it's really fun because you get to see, it's like a Shark Tank night, and they come and pitch. But we got a grant last year that funded our intake specialist for the year, and that made such a huge difference in our ability to get people services quickly.
Wow, that's great. I have one more else.
Contact about volunteer opportunities.
It's on our website.
Okay.
Yep. Yep, so if you go to the website, I think it's under the Connect With Us tab, there's volunteer opportunities there. And if you have kids who are looking for summer internships, law clerks, whatever, you know, I will say our internship program's amazing for giving kids an opportunity to do real hands-on substantive work in an internship. They're not stacking chairs, they're helping people. So it's a great opportunity for a kid who maybe wants to make a difference with an internship, but either during the summer or during the school year. College students and up.
This would be like in any state, right? This organization or is it?
No, we are just here. There are similar models in other states that cropped up when the legal aid funding changed. I will say Kentucky just lost Kentucky Justice Center because they, like us, were really hit with the federal funding cuts. I mean, we had over $1 million in federal funding that we lost out of a $4 million budget. So, you know, the changes are affecting the nonprofits too. They're affecting our funding, our model, our ability to be sustainable, and then all of the other organizations we work with, the organizations we refer to for immigrant help, for marketplace help, for food support. We're having the highest need in the nonprofit community ever and the least amount of resources. So whatever nonprofit you support, do it more.
Emily, thank you so much for being here.
Thank you.
I have one more announcement before we leave. Next month, our meeting is, as always, the third We'd steal the month at 1, but we'll be back at the Martin Center in Brentwood next month. And then come spring, all of our meetings will be here at the Williamson County Public Library main branch. But on November 19th, we're going to hear from Franklin Special District Board Member Alina Bell and from Williamson County School Board Member Melissa Wyatt. So thank you all for being here, and we'll see you next month.